Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we are looking into the post-exposure prophylaxis. The post-exposure prophylaxis for the tetanus. So you have A to D categories. So A means that the full immunization of booster. So you have full immunization. This is A. A is for full immunization or a booster. This will be within 5 years, within the past 5 years. B means it is 5 to 10 years. C is greater than 5, greater than 10. Then comes D, that is the unknown or never taken immunization. So we have A, B, C and D. So in case of A, in case of a clean wound, you only do a wound care. And unclean also you perform the same. In case of B, there's a wound care and the TT single dose. In case of unclean, you have wound care plus a single CT dose, so similar thing. So in C, you do a wound care plus TT single dose, but as in unclean wound, you add along with the TT single dose, you also do a human tetanus immunoglobulin. Human tetanus immunoglobulin. Then comes D. In D, in case of a clean wound, you do a wound care and TT complete course is what you do. And in unclean, you do a wound care TT complete course as well as a human tetanus immunoglobulin. To learn and grow daily like this, please do subscribe.